Hi, my name is Dr. Joe Nelson, and today we're going to be discussing estrogens. Although we often talk about estrogen as if it were a single hormone, it is actually a group of sex hormones, specifically estradiol, estriol, and estrone. All of these hormones have similar effects, but they differ dramatically in their potency. Although estrogens are prevalent and have important effects in both men and women, we'll focus today on their effects in females. One way to think about these three hormones is to recognize their impact on various stages of a woman's life. First, estradiol is the most abundant sex hormone during women's reproductive years and is also the most potent. I remember this by imagining estradiol dialing up estrogen's effects in the body. Estradiol is synthesized only in the ovaries and only during women's reproductive years. Usually when we talk about estrogen, estradiol is really what we're referring to. Estrone, on the other hand, is synthesized predominantly in peripheral adipose tissue and is much weaker than estradiol in terms of its estrogenic effects. After the ovaries stop making estradiol after menopause, estrone becomes the predominant sex steroid in women. Imagine the ovaries, exhausted from a lifetime of service to the body, looking at peripheral fat and saying, "You're on your own." Finally, estriol is synthesized primarily in the placenta, so it's only around during pregnancy. During pregnancy, it's produced in massive quantities and is the most abundant estrogen, but its effects are far weaker than either estradiol or estrone. However, during pregnancy, levels of all three hormones are markedly increased as well, but none is pronounced as estriol. Like all steroid hormones, estrogens freely cross cell membranes and have a receptor within the cytoplasm of their target cells, which then moves into the nucleus and alters transcription. In terms of regulation, both LH and FSH stimulate increased production of estradiol in the ovary. Estradiol in turn inhibits FSH and LH with negative feedback until the LH surge, when it stimulates increased production of LH. We'll talk more about that in our video on the menstrual cycle. Let's talk about what the effects of these sex steroids have on various tissues in the body. Estrogens cause the development of female primary as well as secondary sex characteristics. They stimulate the development of the genitals and breasts, including the development of follicles in the ovaries, thickening of the vaginal wall, increasing vaginal lubrication, stimulating the growth of the uterus and the endometrial lining. They also increase fat storage in a female distribution. In the bones, estrogens close the growth plates and halt linear growth of bones. Because girls usually start puberty earlier than boys, this causes women to have slightly shorter stature than men. Estrogen also increases bone formation and reduces bone resorption over a woman's lifetime. This is why women are more susceptible to osteoporosis after menopause. In the blood, estrogens increase the levels of transport proteins, including sex hormone-binding globulin. They also increase HDL and decrease LDL, significantly decreasing women's risk of cardiovascular disease compared to men. Estrogens, usually combined with progestins, are also used in contraceptives to inhibit ovulation, as well as hormone replacement therapy after menopause. That's all we have time for today. Feel free to continue our series with our videos on androgens, progesterone, and how these hormones all work together in the menstrual cycle.